welcome to our deep dive all about dementia. You all requested this one and gave us a ton to dig into.
Yeah, some really fascinating stuff. We've got medical textbooks, research articles, even some historical perspectives on dementia.
Exactly, so no medical degree needed here, folks. We're just diving in to empower you all with some solid knowledge about dementia.
Stuff you can actually use.
And it's amazing how much we've learned about dementia, but also how much is still out there to discover.
So true. So to kick things off, what pops into your head when you hear the word dementia?
Dementia can be kind of a tricky term. It's not one single disease, right?
Right.
It's more like an umbrella term for conditions that cause cognitive decline.
Okay, so we're talking memory, thinking, behavior, that kind of thing.
Exactly. And importantly, this decline is significant enough that it messes with daily life. That's a key point.
So it's more than just forgetting where you put your keys every now and then. It's got to really impact your ability to function.
Right. And, looking at all this material we've got, it seems to really focus on one type, in particular, Alzheimer's disease. Yeah, that seems to be the big one.
It is. It's the most common type of dementia, accounts for a large chunk of the cases. So it makes sense. It gets a lot of attention. But it's also crucial to remember we've got to rule out other causes. That's something the sources really hammered home.
It's interesting, though, how Alzheimer's wasn't always seen as so common. Like I was reading, it was considered pretty rare until the mid-20th century.
Yeah, what shifted in our understanding, right?
Exactly.
Well, the history of Alzheimer's is a whole rabbit hole. It all started back in 1907 when this doctor, Alois Alzheimer, documented his very first case.
Ooh, tell me more.
It was a 51-year-old woman who had unusual memory loss and these changes in her behavior. And back then, get this, he observed these abnormal protein clumps in her brain.
Are those the amyloid plaques and tangles I've heard about?
Ding, 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 you got it.
Okay, but remind me why those are so important. I'm a little fuzzy on the details.
Sure. So picture this amyloid plaques. They're like this sticky protein buildup that happens outside brain cells. And then you've got tangles, which are these twisted fibers inside the cells. And basically they mess up communication. And eventually those cells, they just die off.
So for a while there, scientists were trying to figure out if those plaques and tangles were the cause of Alzheimer's or just a result of it.
Exactly. It was a real medical mystery.
Yeah.
But over time, research has pointed to what we call the amyloid hypothesis, which basically suggests that these plaques and tangles, they're like the key dominoes that set off this whole cascade of events that leads to Alzheimer's.
Okay, that makes sense.
Yeah.
But it's clear from what we've been reading that diagnosing dementia, and specifically Alzheimer's, is a lot more involved than just checking for memory problems, right?
No, absolutely. The sources really stress the need for a thorough evaluation, getting the patient's history, family history. It's like piecing together a puzzle.
And there was something else in the sources about avoiding assumptions based on a person's education or age or cultural background. Why is that so important?
Because all those factors, they can impact how someone performs on cognitive tests, which are a big part of diagnosing dementia. Like someone with less formal education, they might score lower, not because of dementia, but because of their background,
So you got to look at the whole person, not just their memory.
Exactly. And speaking of looking, let's not forget about brain scans. I'm sure you're thinking about those too.
Oh, yeah, definitely. Those got to be in the mix somewhere.
You're right. Imaging techniques like MRI and CT scans, they can show structural changes in the brain that we often see with dementia. But the sources are clear. These scans, there's just one piece of the puzzle. They can't diagnose dementia on their own. It's all about putting together all the information we have.
So it's really a holistic process.
You got it.
Wow, it's amazing how complex this whole world of dementia is. We've only just scratched the surface of Alzheimer's, and there's a whole bunch of other types out there.
Yeah, it really is like detective work trying to figure out the specific type of dementia someone might have.
Our sources definitely emphasize that. It's not just a one-size-fits-all kind of thing.
Yeah.
And they spend a lot of time on how to tell the difference between Alzheimer's and other types, especially frontotemporal dementia or FTD.
Yeah, FTD. It often flies under the radar, but it's really important to understand how it's different from Alzheimer's. They both affect the brain, but in different ways. You see, Alzheimer's typically starts in the hippocampus, that's the memory center of the brain. But FTD, it goes after the frontal and temporal lobes. Those parts control personality and behavior.
So with FTD, you might see changes in someone's personality, like maybe they become impulsive or apathetic, even before they start having memory problems.
Exactly. Someone with FTD might start acting inappropriately in social situations or lose interest in things they used to love. And if you're not careful, those changes could be mistaken for just personality quirks or even mental health issues.
That makes the whole diagnostic process even more crucial, right? You don't want to be misinterpreting the signals.
Yeah, absolutely. And that's where detailed cognitive testing comes in along with neuroimaging to help pinpoint which areas of the brain are affected. That's key for getting the right diagnosis and figuring out the best way to treat it.
And it's not just about telling the difference between different types of dementia,
Yeah.
right? The sources also talk about ruling out other conditions that can look like dementia.
Oh, yeah, for sure. Think
Yeah.
about it. Depression, delirium, even side effects from certain medications, all those things can cause cognitive impairment that could be mistaken for dementia.
So it's like a process of elimination, making sure you're targeting the real root of the problem.
Exactly, because misdiagnosis can have some serious consequences. You wouldn't want someone to be prescribed dementia medication when what they really need is treatment for depression or a change in their meds.
That really highlights the need to look at the whole person, not just their cognitive symptoms. And speaking of taking a wider view, it's fascinating to look back at how our understanding of dementia has changed over time.
Yeah, the sources have some interesting historical tidbits. For centuries, dementia was just seen as an inevitable part of getting older, like a natural decline. There wasn't much distinction between different types, let alone any real understanding of what caused it.
So it's just like, oh, that's what happens when you get old.
Pretty much. They used to call it hardening of the arteries, which we now know is actually vascular dementia, but overall their understanding was pretty limited.
And then Dr. Alzheimer comes along and shakes things up with his observations about those plaques and tangles.
Yeah, his work was a game changer. It opened the door for a much deeper understanding of dementia. And as research progressed, other forms of dementia, like vascular dementia and FTD, they were finally recognized as their own distinct conditions.
It's amazing how far we've come in a little over a century. But it seems like there's still so much we don't know, especially when it comes to treating it effectively.
You're right. We've made some progress in understanding dementia, but finding a cure or even a way to stop it from progressing is still a big challenge. But the good news is our sources do explore a bunch of different approaches, both medical and non-medical, that can help manage the symptoms and improve quality of life.
I think a lot of people, when they hear treatment for dementia, they immediately think of medication. What do the sources say about that?
Well, for Alzheimer's, there are medications called cholinesterase inhibitors. These drugs work by boosting the levels of acetylcholine in the brain.
Acetylcholine. Remind me what that is again?
Oh, it's a neurotransmitter, basically a chemical messenger that helps brain cells communicate. And it's super important for memory and learning. So cholinesterase inhibitors help preserve acetylcholine, which can slow down the cognitive decline and help with some aspects of daily functioning in people with Alzheimer's.
So it's not a cure, but it can make the symptoms more manageable.
Exactly. And it's important to remember that medication is just one part of the picture, and it doesn't work the same way for everyone.
The sources also talk about these non-pharmacological approaches. What exactly does that mean?
It's a pretty broad term. It covers a whole range of interventions, including things like behavioral therapies, environmental modifications, and support for caregivers.
Can you give me some specific examples? I'm having trouble picturing what those would look like in real life.
Sure. So behavioral therapy might involve teaching someone techniques to manage agitation or anxiety, or creating a structured daily routine to reduce confusion and give them a sense of predictability. And then with environmental modifications, you might do simple things like improve the lighting, reduce clutter-labeled drawers, just to make the environment easier for the person to navigate.
That makes sense. It's all about making the environment work for the person.
Right. And then there's caregiver support, which is so important because caring for someone with dementia can be incredibly demanding, both physically and emotionally. So caregivers need support too. This might mean giving them access to education and resources counseling, or even respite care so they can take a break.
The sources really emphasize the importance of early diagnosis and intervention. Why is that so crucial?
Because early detection means you can start treatment and support sooner, which can potentially slow down the progression of the disease and improve quality of life for both the person with dementia and their family. The earlier we catch it, the better equipped we are to manage it.
But I imagine it can be tricky to recognize those early signs.
It can be. It's all about being aware of subtle changes, like memory lapses, difficulty with familiar tasks, mood swings, changes in personality, and not just brushing those things off as, oh, they're just getting older. If you notice any changes that worry you, it's always best to talk to a doctor.
Which brings us back to the importance of those thorough diagnostic procedures we talked about earlier.
Exactly. A comprehensive evaluation with cognitive testing, neuroimaging, and a review of medical and family history is essential to make sure you're getting the right diagnosis. It's like putting together a puzzle, gathering all the pieces to see the whole picture.
And sometimes, even with the best diagnostic tools, dementia can still present with some really challenging behavioral and psychological symptoms. Those must be incredibly difficult for both the individual and their caregivers to deal with.
They absolutely are. And our sources go into detail about how common these symptoms are and how to manage them. The key is to understand what's causing them.
Like, what are some common examples of these behavioral and psychological symptoms?
Well, you might see agitation, aggression, anxiety, depression, even hallucinations or delusions. There can also be sleep disturbances, wandering apathy. It's a pretty wide range.
Yeah, that's a lot. And I imagine each symptom needs a different approach.
Exactly. You got to figure out what's driving the behavior. Is it pain, discomfort, side effects from medication, environmental triggers? Once you understand the cause, you can develop specific interventions to address it.
So it's not about just suppressing the behavior, but actually getting to the root of the problem. And I'm guessing those non-pharmacological approaches we talked about play a big role here, too.
Absolutely.
Right.
Creating a calm and structured environment, providing meaningful activities, using clear and simple communication, all those things can make a huge difference.
But are there times when medication is necessary?
Yes, sometimes medication might be needed to manage specific symptoms like anxiety, depression, or psychosis, but it's always a balancing act, weighing the potential benefits against the risks of side effects and making sure you're using medication carefully.
We've covered a lot of ground here, from the science behind dementia to the very real impact it has on people's lives. But our deep dive isn't over yet. Stay tuned for part 3, where we'll explore the latest research, potential breakthroughs, and new trends in dementia care. So we've covered a ton in our dementia deep dives, the different types, the whole diagnosis puzzle, the various treatment approaches. It's a lot to take in. But now I'm curious about the future. Like, what does the future of dementia care look like? Do our sources offer any hope?
Definitely. One of the most promising areas of research is prevention. We may not have a cure yet for most types of dementia, but we're learning more and more about things we can actually do to potentially lower our risk.
So it's not all bad news. There are things we can control.
Right. Think about heart health. We know that things like diet and exercise play a huge role in preventing heart disease. And similarly, research is showing that what's good for your heart is good for your brain, too.
Okay, I like where this is going. Tell me more. What are some of these brain-boosting habits our sources mention?
Well, staying at a healthy weight, keeping your blood pressure and cholesterol in check, getting regular physical activity, those are all super important. And don't forget about mental stimulation. Things like reading puzzles, learning new skills, anything that keeps your mind active and engaged.
So put down those phones, everyone, and pick up a book.
Got it.
Got it. What about family history, though? Does having a family history of dementia mean you're doomed?
Not at all. Genetics definitely plays a role, but it's not the whole story. Lifestyle factors can have a big impact, even if you have a genetic predisposition. In fact, some studies suggest that a healthy lifestyle can actually lower your risk of developing dementia, even if you have a family history of it.
That's amazing. It's like you can take control of your brain health destiny.
Exactly. And beyond lifestyle changes, there's a lot of exciting research going on in drug development and other innovative therapies.
Ooh, tell me about those cutting-edge advancements.
Well, researchers are looking at new drug targets, like drugs that aim to reduce the buildup of those amyloid plaques in the brain. And there's growing interest in immunotherapy, which is basically using the body's own immune system to fight the disease.
That's like having your own internal superhero squad battling dementia.
Exactly. And there's even research into non-invasive brain stimulation techniques like transcranial magnetic stimulation, or TMS. These show some promise for improving cognitive function and maybe even changing how the disease progresses.
Brain-boosting technology. I love it. It all sounds so futuristic. But as we've been talking about, dementia is more than just a medical condition. It's a human experience. Science alone can't solve the ethical issues, the burden on caregivers, the emotional toll it takes.
You're absolutely right. And that's why we're seeing a shift towards more person-centered approaches to dementia care. It's about recognizing the individual's unique needs and values and preferences and creating care plans that put their quality of life first.
So it's less about trying to fix them and more about understanding and supporting them as a person.
Exactly. It's about creating supportive environments, fostering social connections, and empowering both the person with dementia and their caregivers.
It's about remembering that someone with dementia is still a person with their own history and relationships and a desire to live a good life.
Well said. And it brings up another important aspect of dementia care that's often overlooked: the role of arts and culture.
Arts and culture. How do those fit in?
There's more and more research showing that engaging with the arts can be incredibly beneficial for people with dementia. Music, painting, dance, these things can evoke emotions, trigger memories, and provide a sense of joy and purpose.
So it's about nurturing the soul, not just the mind.
Exactly. Imagine someone with dementia seemingly lost in their own world, and then suddenly they come alive when they hear a familiar song or they start creating a beautiful painting. It's incredibly powerful, and it shows that deep human connection we all have, regardless of our cognitive abilities.
That's a beautiful image. It
Yeah.
reminds us that even with dementia, there's still room for beauty and connection and meaning.
And that's what we want you to take away from this. That dementia may bring challenges, but there's hope too. Through research and innovation and compassion, we can work towards a world where people with dementia can live with dignity and support and a sense of purpose.
Well, we've certainly explored a lot in this dementia deep dive. Thank you all for joining us on this journey. We encourage you to keep learning and talking about dementia care. Remember, knowledge is power, and together we can make a difference.